This is Average Joe PT, and on this episode, we're going to talk specifically about disc issues and 3 treatments that are a little bit different for disc issues versus any other treatment that you're going to do for a back problem. Last episode, we talked about facet joints and arthritis and the treatment plans for those. Now, this episode, we're going to talk about three big ones that you're going to do for a disc. So I want you to stick around so that can help you with your issue. All right, so number 1. So when we're talking about a disc problem, we're talking specifically about that disc that's pushing out onto the nerve and then kind of comes back in and starts the inflammatory process. Now, what are we going to do with that type of disc issue? We're going to go ahead and do the big 3 things that we did: icing, anti-inflammatories, and changing the position that caused it. So it was a lifting problem. You're going to have to stay away from lifting for probably 4 to 6 weeks, anything in that type of movement that you're doing before. So that's number 1. Number 2, if you're having a disc kind of problem, what you want to focus on is staying away from that prolonged sitting, which is going to make that disc push out because you're flexing that lower part of your spine. Now remember, I've talked about in previous episodes, the one that really blows out the most when it comes to disc is your L5-S1. And the reason for that, that's where 50% of your movement of bending forwards and bending back comes from. That bending forwards and bending back, 50% of that entire movement occurs at that one segment, which is L5-S1. It kind of has that weird angle in it. And that unfortunately gets us upright walks, but the downside of it is it does put a lot of extra stress on that last disc. So that's number 2. Number 3, when we're talking about a disc problem, how you want to treat it. Now, we talked about the ice, we talked about the drugs and anti-inflammatories. Now, the big one that you can do at home really is to get up and walk around. Stay away from the static positions, whether it's too much sitting or too much standing. You want to be on your side, on your back, on your stomach. If you're on your stomach, which is a good spot as long as you don't feel like you're shooting pain down your leg, you want to go ahead and put a pillow underneath your belly to basically lift up that a little bit right there. So if we were lying on our stomach, we would be like this with our spine. So with a pillow underneath, we'd be up a little bit and we'd kind of put that spine in a nice level position, and that's what you want to do. You want to be nice and level as much as humanly possible to try and reduce that stress on that disc, because it's one of the hardest structures in the body, and you figure you went through all those years without damaging it, and all of a sudden it kind of blew out on you. Now there's several different kinds of disc problems. Okay, so disc number 1 kind of problem, we describe it as just a bulge. It pushes out and it pushes back. Disc problem number 2 is a herniation. It pulls all the way out into that disc space where that nerve is floating at. That nerve is floating on those edges all the way. As that spinal cord comes down that bony structure, that spinal cord comes out with little nerve endings called peripheral nerves, and that's what gets pinched on those discs. So that herniation is out there in that joint space where that nerve is at, and it's just hitting it. And then there's fragmentation, where literally a piece of the disc breaks off of, and it's just floating and kind of bounce around, causing all kinds of issues. So those are the 3 main ones when we're talking about a disc. Most times, if we're talking about someone just lifted, it wasn't some sort of traumatic fall or traumatic car accident or some sort of traumatic twisting motion like on a football field, then we're just dealing with probably a bulge where the disc pushed out and then went back in and caused this cascading of inflammation and got that nerve really hot and giving you symptoms down your leg, which if you do the treatments that I've described here, will really help get you back in recovery. Now, the most important piece that we always talk about, that I leave out, that I talk about on my walks, is that what do we do after we've healed? The nerve is calmed down, which means is the pain has gone out of your leg, out of your hip, and come back to the lower part of back, which is the centralization. And then you're going to have a little bit of increased back pain as your leg symptoms goes away, and that's normal. Expect that. So once you've recovered to that whole phase where the nerve pain is gone, radicular symptoms, we want to start to strengthen that part again so it doesn't happen to you over and over and over again. So I'm going to leave a little link up there underneath my back protocol, but just to kind of give you just a brief synopsis of what that basically entails is some back strengthening exercises where you're lying on your stomach supported. That's very important. We have some core stability exercises to the front because we want to support the front and the back of the spine when we're strengthening that joint area. And we want a little bit of flexibility, not a lot, because more times than not, if you're having a disc issue, it's because you have too much flexibility or too much flexibility occurred in the spine to cause the disc issue to begin with. And we want a more rigid spine. And to have a more rigid spine or stiff spine, we want to have strengthening in the front as well as behind the back. So that's the piece that's really missing through a lot of people is they'll recover and think, oh, I'm good, my symptoms are gone, and not thinking that, hey, we're going to have to go ahead now and focus on not only recovery, which we've just gone through, but getting to the next phase, which is making sure that this doesn't happen again. Now, the most important thing I always leave out is at the very end is after you've gone through those phases and gone through that strengthening component is that you have some sort of program afterwards. 2-3 times a week, I want you just to go out and walk. Now, if you have any questions at all in regards to that, I want you to leave them down below, positive or negative. Scully and I always like to hear them. And, what's another topic you want me to bring up? I've talked about the spine. I'm going to talk a little bit more about the spine, but I got lots of stuff: shoulders, necks, hips, ankles, you name it. I've probably seen it or treated it. All right, so until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.